Hello everybody and welcome. I'm Tamsin Rose, the Senior Facilitator for the Africa-Europe Foundation. Welcome to this first in a series of new events. And this is a series we're calling the AU-EU Tracker for Special Dialogue. This afternoon we're focusing on pandemic response. Future episodes in this series will look at different aspects. We're focusing in on health. The good news is that just recently the World Health Organization announced an end to the public health emergency of the COVID pandemic. But we need to make sure that we have learned the lessons, and as we move forward, the world is stronger, that our health systems are more resilient, and we're able to cope with whatever is coming. We have a live audience joining us, and I have a fantastic panel of speakers, but we want you to play a very active role. So please put your messages in the Zoom chat and your comments, your questions, and your contributions. You will help to make this special dialogue a success. Now, our first keynote speaker, I have to pass her apologies. That's President Ellen Sirleaf-Johnson, who unfortunately is now on an airplane because it was her flight was delayed, so she's unable to join us. But her context here is she recently published, together with the former Prime Minister of New Zealand, Helen Clark, a report called A Roadmap for a World Protected from Pandemic Threats. And this seeks to identify what decisions need to be made, what political actions need to be made, and how, as the world moves out of the emergency period of COVID, we've actually got the things in place that will deliver better results next time around. And she identified 6 key points, and I'm going to just name them for you because I think we'll touch on them in our dialogue. The first thing she said is we need political leadership, and not from the ministers of health, but from the heads of state, from presidents and prime ministers. The COVID response was hampered by that lack of political coordinated leadership. We had countries that closed their borders one against the other, which held on to their medicines and their respirators. The future in a pandemic is collaboration and cooperation at senior level to avoid catastrophic multi-sectoral impacts. The second area that the report highlights, the roadmap, it says we need international rules that are fit for purpose, rules that are clear, rules for pandemic prevention, preparedness and response. They should work towards a successful conclusion, and they should give the powers, and the rules should allow the organizations to detect, report, investigate and to stop pandemic threats wherever they occur. Thank you for someone who's already joining us and is indicating in the chat they're coming from Guinea. Thank you. It's always lovely to see where you're from, so please let us know in the chat where you're joining us from. The third area where we need to take action in the roadmap is we need independent monitoring. The independent monitoring is needed to increase the accountability and the transparency. We need a fully independent, multi-sectoral expert monitoring board that could collect and analyze data from different sources and publish authoritative public reports that would build confidence in our understanding of science. The fourth area where we need to get a clear political response is we need an equitable and operational ecosystem for pandemic countermeasures. It can't be that the richest or most powerful countries are the ones that get access to the countermeasures. This has to be something that is shared equally, and all countries should have in their public health goals to make sure that all communities are served equally. The fifth area in the roadmap, and this is, I think, something key for governments to think about, is we need sufficient financing for preparedness and for crisis response. This additional funds needs to be put on the table, and it needs to be balanced against the trillions of dollars lost through the COVID pandemic. Investing in prevention and pandemic resilience saves money over the short, the medium, and the long term, but it does mean putting that money up front, and this is very clearly in the roadmap. And finally, the role of the WHO is highlighted and strengthened in the roadmap. We need an independent and authoritative WHO with the resources, the expertise, and the political space to coordinate and lead the pandemic response from different member states. And member states need to support the WHO in this role to collaborate and cooperate so that the WHO is itself able to offer the capacity needed for member states. So, and just as a reminder, 7 million people have died as a result of this pandemic. Hundreds of millions have been infected, and billions of people have had a vaccine. So we know that over the last 3 years, we have globally been tested in a way never done before. So what we're going to do this afternoon is, as I said, the first in a series of dialogues where we want to have an honest conversation, where we can be frank with each other about what works, what doesn't work, and how we make sure we learn the lessons from what everyone has just been through. So let me introduce our first speaker, and that's Dr. Jen Kisaya, who is the Director General for the Africa CDC. Now, the African CDC played an extraordinary role in the response to the pandemic in Africa. It has recently been upgraded as an institution and given more power, authority, and resources. So Dr. Kisaya has a very busy in-tray and quite a long to-do list. So Dr. Kisaya, let me ask you, what are your priorities going forward to make sure that Africa has a strengthened response to the pandemic we've just been through and the health risks that are coming that we can't foresee yet? Dr. Kisaya.
Thank you very much for inviting me today. I hope you can hear me.
We can.
Yeah, thank you very much. Yes, Africa CDC for me will continue to play a critical and strategic role in relation to pandemic preparedness, prevention, and response, as well as broader health systems and existing epidemics through 6 pillars for the next 5 years. The first pillar will be the proactive surveillance and intelligence gathering for early warning system. The second one will be the robust emergency preparedness and response for all public health emergencies. The third one will be to strengthen health system in Africa to prevent and control diseases which can be applied to both communicable and non-communicable diseases. The fourth pillar will be to strengthen the national public health institutions and ministries of health across the continent, including the development of effective workforce. And the fifth one will be the expansion of clinical and public health laboratory system and network. The last one will be to industrialize the health product and technology innovation and manufacturing. Around this, Africa CDC will continue to lead and coordinate continental effort and support member states and African institutions to proactively address public health issues and respond to public health emergencies. This is what I can give you as an answer for this preliminary question, but I think I will have opportunity to develop more with questions that we get from the audience. Over to you. Thank you.
Thank you very much, Dr. Kisaya. The report that President Johnson put forward, the first key element in her roadmap was political leadership at the highest level. And as I mentioned earlier, the ACDC as an institution has been upgraded. What can you tell us about the level of political commitment you see from the leadership within Africa? Because health is now really right on the agenda. And you've got this very ambitious 6-pillar plan that will need a lot of political support to make it happen. Do you feel that governments are now saying, oh, the emergency is now over, we can relax and do other things? Or do you think this translates into real sustained political commitment?
Yes, I can confirm. First, because all of these African leaders, they decided to give autonomy to Africa CDC. I have to say that this is the new Africa CDC. The previous one was struggling, facing the bureaucracy of African Union, It's well known, it's not a secret. And they decided to give autonomy to Africa CDC. And this autonomy is from A to Z. It means today we are able to manage our program to better support member states. But this political leadership, we have also to push the full understanding of that by President Ellen Johnson. I met her 3 weeks ago in Nairobi during the Mo Ibrahim Foundation meeting. We were discussing this issue. And I totally agree with her, because we need to avoid a multi-sectoral chaos, as she's saying. Now, my discussions with head of state, and let me share with you that 6 days ago, I was meeting President Azali in Comoros. He's leading now the AU. And then I flew to meet President Embalo in Guinea-Bissau in his capacity as president of ECOWAS. All of them, in addition to head of state that I managed to reach out over the phone, they really support what we call the new public health order in Africa. It means they are giving full political support to push the agenda of health. And we are talking now about the financial sustainability. We are talking now about health workforce. I think all of these agendas, they are fully on board and they are supporting. This is what I can see from now.
Excellent. Thank you very much, and very positive to hear that you have direct access to the heads of state, they're interested, and the strategic response is ongoing. So on this role of political relationships, I'm now going to bring in our next speaker, because the EU is very proud of its relationship with Africa, and it's got a commitment to support African leadership in its response. And the person who's next going to speak to us is Dr. Anders Nordstrom, who has two hats at the moment. He is the ambassador for global health at the Swedish Ministry of Foreign Affairs, and Sweden holds the rotating presidency of the European Council at the moment, so hence the two hats. And I know that you also worked for more than a year with President Johnson on that report that I just mentioned. So you're very well engaged in how we can get a better, stronger global response to future health threats. Dr. Nordstrom, please go ahead. What do you see as the role of the relationship between Africa and Europe? What can partnership do to deliver a better response?
No, thank you very much. I'm delighted to be with you. And let me first congratulate Dr. Kaseya in your appointment now as the next new head of the African CDC. We're very much looking forward to working with you. This AU-EU dialogue, I think, is extremely not just important, but also timely, and I will say why in a minute. But what we learned when I was working with President Sirleaf on the independent panel was very clearly that regional cooperation matters a lot. And what we have seen emerging also now during the pandemic is that regional cooperation, the political agenda on health and the pandemic, but also the resources have increased quite substantively. That means that we need a different kind of partnerships now moving forward. So I think the new African public health order, and now what we are working on in Europe, which is the new strategy for global health, are two very timely sort of initiatives, but it will require a different kind and way of working. You were saying that we from the EU has been supporting African countries. I think in the future now, or right now, we should drop the word supporting. But instead, we need to work together because we have a mutual interest in doing this. And it's much more seeing those mutual interests in a partnership, I think, is the way forward. So this strategy now that we are working on from the European side has basically three new components, both substantively, building on the WHO 3 pillars, and very much in line what we heard also from the African CDC in terms of preventing people from falling sick, looking at health risks broadly, including also what is coming now from climate change. Second one on universal health coverage, access to good quality health service and effective health systems, and then how you deal with outbreaks and diseases. So it's a new content compared to what we had in the past. But second, I would say even more important, this is also a strategy that should take us beyond aid. Aid is still important, but also that what we do collectively together here in terms of research, trade, climate, food is just as important contributing to improving people's health. And the third one is, as I mentioned, we will need now a different kind of partnerships. It's about working together. We still need certain things, certain functions to be happening and to be performed at the global level. So it's not enough with stronger nations, stronger regions, but we still have, but quite a different agenda then in terms of what we need to address collectively at the global level. And let me finish also by saying I was delighted to hear about, I was not part myself in Kigali in the meeting where I know another participant here at the meeting, Benjamin from the African CDC, you were facilitating a dialogue around global health diplomacy and politics. And I think a lot what we do today is not about the what, it's about the how. Understanding the political context. There are huge interests from many parts of the world really to see how we can navigate the health agenda better politically. Then we need more competence when it comes to political economy, understanding the politics, understanding what diplomacy could give us. And I know this is a priority from the African Union and from the African CDC, and from the European side, definitely as well. So this is an area where we would be very keen, and I think just this meeting today, to be able to have more dialogue, could be one way of also taking that work forward. Thank you.
Thank you. Well, before you go, could you tell us a little bit more about the global health diplomacy as a concept? Because health is something that, it's so important to everyone, but as you also acknowledged, there are a lot of competing interests. We saw that in COVID, people sort of returned back to their issue of sovereignty, and they wanted to protect their borders, they wanted to keep their medicines and their respirators to themselves. So this global health diplomacy, is that the signal of the important political leadership that was called for in the report, or is it something more sort of low-level, more day-to-day connection between the sort of work of Dr. Jean Kasaya and the public health institutions? Can you add something to that?
Absolutely. First to say, I will stay with you, so I'm not leaving. I'm very interested in this discussion. The idea here is a bit more targeted, thinking that people coming from the health sector, myself being a medical doctor now, even if I've been an ambassador for 13 years, but still I'm not a trained diplomat. But to equip health people with more than knowledge in terms of political science, political economy, understanding dynamics, power plays, how do you actually navigate in the landscape of politics, and especially the non-formal ones. One are the formal negotiations, whether it's in the African Union, whether it's the European Union, or whether it's at the global level or at the national level, but there are ways of understanding better how you can navigate to a successful outcome. And also for people that are more on the political side, or beginning from the political side or from the diplomatic side, seeing how they can actually be equipped by using health, and especially public health priorities, as a means also for other kinds of negotiations and making good relationships. So in some way, at least the thinking is that how can we basically equip public health people with more of knowledge about diplomacy, politics, and political economy, and then diplomats with a little bit more of health knowledge, and then seeing how we can have a greater and bigger community that could potentially also connect, and especially connecting practitioners and learning from each other to see how we can be more successful, making sure that we are navigating in the political reality. Because some people believe that the political reality is only about the medical evidence, and it's definitely not. There is a rationale to the politics, and that I think we as medical or health professionals, we need also to be aware about, and in some way to appreciate and to respect. So that is what we are thinking about medical or health diplomacy.
Excellent. Thank you very much. And as you said, the evidence doesn't sit on its own. It fits into a broader picture of, political rationale, trade-offs and other issues. So it's important that both the scientists, the clinicians and the politicians have a means of communicating and negotiating. Talking of this issue of partnership and, doing things differently, just this week, the African Union and Gavi have signed a memorandum of understanding to increase access to and uptake of routine vaccination in Africa. And at the same time, there are 7 members of the European Parliament that are heading to Senegal this week, and they want to look at progress in vaccine manufacturing, and particularly the EU's funding and support to increase access to vaccines, drugs and health technologies on the African continent. So this important issue of, meeting global health needs and ensuring that there can be domestic manufacturing is a key issue. But that's just one part of it. We need to look much further upstream at the issue of research. So I'm going to invite Dr. Jeremy Knox from the Wellcome Trust to tell us a little bit about, where we are on the sort of global research agenda. For a long time, a lot of the research went on issues and clinical diseases that affected the richer countries more than the rest, and we had a very imbalanced. And yet, the COVID pandemic showed us that we can move out new health technologies like the RNA vaccines, building on years of international research. So where are we? What are we looking at in terms of the balance of clinical trials, clinical research? Is Africa visible enough? Is it present enough? And how do we balance that out?
Thanks very much indeed. Hopefully you can hear me, and thank you very much indeed for the chance to take part in such a fantastic panel alongside such esteemed speakers. I think I'd like to make three overarching points about Wellcome's perspectives when it comes to these research questions you described, and in terms of what we're doing as a funder, but also as someone who increasingly engages in that political space that Anders just described so nicely at the confluence of the health and the global politics. Firstly, and I think this really frames our overall approach, is not wanting to see pandemics as either an isolated or a passing threat. Obviously, our experiences have been, and our standpoints have been very heavily shaped by the experiences of COVID over the past 3 years. But I think we need to be careful that we don't fall into the trap of thinking about how we prepare for and respond just to things that look like COVID or very similar things. And when we're thinking about how we engage with policymakers in the way that Anders just described, we need to ensure, I think, that we're giving a message, we're giving a message when we talk about pandemic preparedness. We're not simply talking about preparing for events that only arrive once every 100 years. Instead, I think when we're drawing lessons from COVID, when we're thinking about the way ahead, we should be thinking about how we can show how investment in pandemic preparedness will deliver much wider benefits across other threats in a much more joined up way. I'm talking about the lower level outbreaks that we know happen year in, year out, particularly in Africa and other parts of the global south, like Marburg and Ebola over the past 12 months. Thinking about the established pandemics like TB, HIV, malaria, and of course, COVID as a continuing pandemic. And then not to forget that, of course, the incipient threat of AMR is something which we know is continuing. And I think we have to recognise that all of these threats, they're not static, they're not stable, they are escalating for a variety of factors, and of course, most importantly, climate change. So this is the overall framing we're trying to apply when we're thinking about our work at Wellcome and thinking about the type of approach that we're trying to ask policymakers to take and how we explain what we mean when we talk about pandemic preparedness, making sure that we're not just talking about a narrow set of things or forgetting the needs of parts of the world that we might overlook. I think kind of a second point I make is around a particular priority for us around, or for the global community, around stronger global surveillance. And there's a very clear acceptance globally, I think, that disease surveillance needs to be significantly improved as a plank of how we prepare to respond to pandemics and epidemics. But again, I come back to this point of not wanting to think about pandemics in isolation and really being able to make the case that when we talk about improving global capabilities for surveillance, we're not just talking about how to respond and identify a pandemic, but instead trying to think about capabilities that will deliver benefits across a much wider set of threats in normal times as well as during a global health emergency like a pandemic. It's vital we can be clear with policymakers what we mean about this. I think clearer than we have been in the past about what investment is needed, where that investment's needed, what this type of capability building involves in practice, and really how to integrate improving surveillance for pandemics with surveillance that underlying threats like AMR and of course continuing issues like HIV and TB and malaria, and also being very clear that we need investment not just in things like genomic sequencing, but actually in much more basic kind of system strengthening and workforce capacity building as well. I'd pick out obviously the work that the Africa CDC has started doing on this. The work that the Global Surveillance Hub based in Berlin have been doing. We've been very proud at Wellcome to have been supporting Chikwe and his team there in building that up. And again, also, I'd bring this back to the point around climate change and really investments we're making, and we're keen to see others making as well, in terms of how we can improve our knowledge of how patterns of weather and climate change affect disease outbreaks, and in turn can then help our understanding and help our surveillance activities. The final point I'd just briefly make is around looking into research into new tools, new countermeasures, so vaccines, therapeutics, and diagnostics to deal with pandemics and epidemics, because for a research funder like us, this is such an important part of the equation. Of course, as you said at the start, Tamsin, we had, on the one hand, stunning success in the innovation that we saw with COVID vaccines and then therapeutics. But that success was sadly offset by appalling, unacceptable inequity in terms of ability to access those tools in a timely way in all parts of the world. At Wellcome, we're trying to address directly the global ability to more rapidly develop and then make available tools in future pandemics through supporting work for the 100-day mission. We're hosting the Independent Pandemic Preparedness Secretariat at Wellcome, which we're hoping can take a global outlook to improving R&D and improving equity in that countermeasure response. But we're conscious this is a much wider issue of infectious disease R&D as well, and we're thinking about the types of change we want to see across the R&D landscape for a much wider set of infectious disease threats. We're concerned as ever that the markets, the private sector left by themselves, won't address or kind of won't properly invest into the research we need to deal with threats, with epidemics that affect Africa, for instance, but not Europe or the US. So we're thinking how we as a funder can really envision and try and play our role in driving fairly radical change over the next 20 years or so in how and where R&D into new infectious disease countermeasures is done and how it's financed. We're determined as part of that process that we can kind of drive changes in what's going into the pipeline, how that pipeline is advanced, and then how the products come out at the end. And also hearing the voices of those who are most affected today and tomorrow by current and by future epidemics, particularly in Africa. And really the purpose of that is wanting to understand how we as a research organisation and an advocate can help shape an R&D system which is much more fit for the future, one where priorities aren't just set in the global north, and where we have equity in how people engage with R&D globally, and how people have access to the outputs of that R&D in the future. And of course, that includes addressing things like manufacturing capacity. So I'll close there because I'm kind of conscious of running out of time. But if I have to just re-emphasize one thing, it's that overarching point, that cross-cutting issue for us of wanting to not think of pandemics in isolation, broadening the dialogue about pandemic preparedness to make sure we're thinking about the interplay, the kind of the benefits, the interaction with this much wider set of health threats that we may face both today and tomorrow.
Excellent. Thank you very much, Jeremy. And a reminder to our audience that you can put your comments or your questions at any point in the chat, and we will be picking them up and putting them to our speakers. I'm now going to turn to Eloise Todd to give us a much needed reality check. We talked at the beginning about the call for the highest level of political leadership by prime ministers and presidents. But with the COVID pandemic, we got a flurry of new initiatives, new money that was announced, new packages. But how much of that was actually new? How much has it resulted in change? So we have a lot of promises that are made. We want to understand how this turns into something real, because they had a warning from Jeremy that there's the risk that we fall into the rabbit hole of let's do things around the pandemic because that's urgent and we recognize the threat. But we still need basic investment in health research. We need investment in primary healthcare. We need to be investing in a health workforce that's there, which is not the hot, sexy topic that you see when there's pandemic response, but it's the foundations on which everything rests. So, Eloise, a reality check now. what can civil society do to keep these promises, make sure they're actually delivered, that these packages of financing and the political attention remains focused on delivering good quality health for everyone?
Thank you so much, and it's a great honour to be here with esteemed colleagues and the great audience as well. So what can civil society do? Firstly, the origins of Pandemic Action Network, we basically sprang up in those early months of 2020 because we were worried and concerned about the lack of civil society voice around COVID in particular. There's a huge global health community, and there are other really strong international development and community organizations all over the world. But this notion of a global pandemic, obviously it was a new experience for the world to be experiencing together at the same time. So we wanted to crowd people in and make sure we were holding governments accountable, because in those early days, it became clear that governments were making very different life and death decisions about how they were tackling the pandemic. So the whole spirit of why we sprang up was to say, we need to make sure we get expert advice from people that know what they're talking about, so that civil society can be activated, push leaders and ministers all over the world in different countries to do the right thing by their people. So that was the kind of origin story of why we came about. Of course, during the COVID years, particularly 2020 and 2021, there was a lot of political activity, a lot of spotlight on COVID. That's all we lived and all we heard about for a long time. That meant also there were opportunities in terms of financing becoming available. Specifically, our interest was to make sure that pandemic countermeasures, be it vaccines, tests and treatments, and PPE, were made available to people wherever they are in the world, that access issue was taken on. Frankly, that was a huge failure in those years. And we are focused now on learning the lessons of that time to make sure we can build differently for the future. And as you've said, Tamsin, and as other leaders, speakers have alluded to, this is not about that crisis period. It's about what work can we do in between times, the whole time, to leave ourselves better prepared for the future. So at Pandemic Action Network, one of our really key points is that we believe that political leadership at the highest level is necessary in order to make the changes that we need for pandemic prevention, preparedness and response. If you think about how governments reacted during the COVID years, we had like national security meetings. In the UK, they call it the COBRA meetings. Different countries have different iterations of that, where you don't just have the health minister, but you have the employment, the finance, the leadership, the education minister, everybody taking a whole of government approach to dealing with the crisis. Now, it's not going to be quite the same rhythm or intensity or urgency in between those hot periods of a crisis, but you absolutely need that kind of whole of government approach, whole of society approach going forward. So while the issue is about a pathogen that affects the health system, pandemics are much broader than that. And as Jeremy said, it's not just a narrow set of issues. We really need to think about how to strengthen systems across the board. And Anders talked a bit about this whole of government and this need for leadership at the highest levels. And thank goodness for the work of the independent panel for pandemic preparedness and response. At Pandemic Action Network, we are delighted to have former President Johnson Sirleaf, former Prime Minister Helen Clark, and all the other esteemed commissioners doing that work, setting out an agenda of what a resilient pandemic preparedness agenda looks like. But frankly, we shouldn't have to rely on leaders that are giving up their great time that have been in office. We need a battalion of leaders that are in charge today to be doing that work and to be speaking up for those issues. And that is something that we are very committed to and something that we try to convert and achieve. In terms of, you know, what advocates did during the COVID crisis, there were very big pushes to make sure that the systems set up, the access to COVID tools accelerator, the work of COVAX, we were trying to make sure that that work was done as equitably as possible. But the truth is that the very system it's based on was based on a free-for-all whereby high-income countries bought out as many vaccines tools that they wanted, and then it left lower middle-income countries at the back of the line. And that meant that we got to this very unsatisfactory frame towards 2021, whereby lower middle-income countries were reliant upon dose donations in terms of vaccines and donations on other things as well. So then there was a push to get countries to give away as many doses as possible. But the truth is we have to completely and fundamentally change that system, which is something that's been looked at through the INB process, this negotiating body that's going to bring about a pandemic accord. And it's really important that we look at the fundamentals there. And I would just say, in terms of the EU-AU dialogue here, there's such a huge opportunity for these two continents to work together on these issues. There's a lot of potential. We've heard about the global gateway. We've heard about the billions. But if you want a reality check, we have to think about, well, where are those hundreds of billions? What have they been invested in? How much of it is new money? And how can we track that? And how can we really make sure that there's not just the promise of finance, but the delivery of it? But also, secondly, that money, those investments need to be invested in a structure and a system that will actually empower and embolden and create regional hubs for the future, whether that's for pandemic countermeasures, for example, whether it's to make sure, as Jeremy was saying, that the R&D is more equitable, that we're actually looking at what research is needed for low-income settings. The whole system at the moment is skewed towards the global north. And so leaders in high-income countries, the EU leaders, have been good at setting out ambition, but we need two things to make sure that delivers. We need practical application with timelines in terms of how those investments are going to be made and what they're going to lead to. But we also need this approach where we're looking at the structural issues, not only the, well, we'll buy up all the tools and give away the spares that we don't need. No, we absolutely need an investment in a different kind of system where it's not inviting lower middle income countries to the table, but they're actually helping design or in the lead designing the future on that. So I think, during the COVID years, we pushed for international summits. We worked closely with President Biden, the G20, G7, African Union, to get some of those pieces on the agenda. A range of commitments were made, and we were chasing down different money through resource mobilization. Now the agenda is one of preparedness for the future. What that means is we need systems that are resilient to pandemics, but also resilient to climate change. If we get things right, we can actually deliver and invest in health systems that will actually, by default, help prevent pandemics because they are accessing people in hard to reach settings. They are building trust in communities through community workers, so you don't just have to switch that on in a time of crisis, but you already have that trust building and that communication and feedback loop, and that there's a much more supply of tools and the value chain and the supply chain is ready. We had a lot of talk during COVID about the need for end-to-end platforms, but the truth is there's the R&D at the beginning and the delivery at the end, and too much focus was on the procurement piece in the middle, buying and giving away, and we have to make sure that we're truly end-to-end in the future. And then I would just talk a bit more about preparedness and prevention, if I may. I've talked a little bit so far about crisis response and some of the issues and challenges we face on a structural level during COVID that we want to change for the future. But this piece about prevention and preparedness, we need to make sure we're working in concert with advocates across different disciplines across climate change, finance, international development, community groups from all over the world, we need to make sure that we're working together so that actually when we deliver these and push for these health systems that are both pandemic proof and climate proof, we're creating a better future, but we're also looking at, well, how can we lessen the risk of zoonotic spillover from animals in, whether it's by protecting huge swathes of forests and nature. We need to look at the connection points between pandemic prevention and the climate fight. And another thing we're trying to do is to make sure that this health agenda, this end-to-end, always-on approach, is also part of the discussions at the big financing summits. And again, you know, we talk about the EU-AU connectivity there. We need to have the EU governments and leadership turning up and really fighting for unleashing tens of billions at those places. And we need to also have our African leadership and ministers making sure they're making their points and their voices are heard also at those international fora. So lots of work to do. We at Pandemic Action Network invite everybody in. We started with 25 partners. We now have over 350, and we want to work with people within the health sector, but also outside of that, because pandemic prevention and preparedness will always be a whole of government, whole of society effort. Thank you so much.
Thank you very much, Eloise. And again, I'm inviting you, the participants, to share your comments or your questions in the chat so we can bring them in. And we already have a couple of questions that we're going to bring forward. We have a question from Björg Persdottir, who wants to explore the issue of the public health, the primary healthcare workforce. Björg, would you like to unmute yourself and go ahead and share your question?
Sure. Well, first of all, it's really great to hear this multi-sectoral thinking and that there's bringing up the important issues, excuse me, of accountability. But I'd love to hear a little bit more about sort of the systemic approach and the importance of strengthening community health systems or primary care health system, and how can we integrate whether it's disease surveillance and other important factors in this. And obviously, what are the ramifications for education and training, both pre-service and in service? How do we build that component as a part of the approach as well?
Thank you very much, Björg. So the question here is, how do we strengthen our core public health capacity, our primary healthcare systems and the workforce in order to have the strong response? And we've heard that from several of our speakers about the if you have a functioning health system, you can respond to a pandemic, you can respond to risks of climate change, and you have a healthier population. It's one of those great win-win-wins. But to do that, we need to change the political discourse. We need to make more funds available. So I wonder if there's anyone who would like to take up that challenge and respond to Björg, saying, what does it mean to actually strengthen our primary healthcare community, to make sure that we have that in place? The floor is open if anyone would like to respond. It could be some of our speakers from earlier, but anyone else, please raise your virtual hand so I know who wants to contribute to that. And this is the challenge that we're looking at, to say we need functioning health systems that are well supplied with a well-qualified health workforce. That should be at the top of the political priority list. And it's that will give us a pandemic response and other threats. Anders, your hand is up. Please go ahead. Is it all about primary healthcare?
Yes, possibly. Primary healthcare and what is happening in the communities. I would just like to share one initiative that I've came across that is also sort of in some way reminding me about what I saw in Sierra Leone during the Ebola outbreak, where we were working a lot with the communities in different ways. And a great partner to us at that time was the Red Cross. And I know that the International Red Cross Federation now are working across Africa, both on surveillance, together actually with the African CDC, but now also thinking about community health workers. Can we expand the cadres of community health workers, important for surveillance, but also when it comes to preventive public health work, broader than just dealing with and preventing or coping with outbreaks of diseases. And that kind of partner, a civil society partner, the Red Cross is not very often part of political discussions, but when it comes to actually having capacity on the ground, they are the largest civil society organization in the world, with quite a lot of volunteers on the ground. And what I saw them doing during the Ebola outbreak in Western Africa, great work and great partnership. So community health workers, and there are, of course, great experiences already from both Rwanda and Ethiopia on that, but it's spreading across the African continent today. Just my, if I may say so, from my Swedish and European perspective, I wish we had a few of those in Sweden as well. Thank you.
Thank you. We've got another question that I think is for Dr. Jean Kesaya, and this is looking at the gaps in genomics. You mentioned on your 6-point plan that I think it was point number 6 was around the public health laboratory networks, making sure it had the capacity. And this is obviously critical at a time of pandemic. You've got to be able to run genetic sequencing to find out what threats you're facing. But that means you need to have trained scientists, experts, you need to have labs, etc. So we've had a question here, what are the prospects to really increase the capacity in Africa for genomic research? And that's also sort of the next step towards precision medicine and the sort of most modern forms of medical care. Dr. Kesaya, can you respond on that? How are you fitting in this approach to genomic capacity?
Thank you very much. I'm taking this call from Cape Town. And I thank you, Rukaya, for asking that. I had the opportunity to discuss with colleagues who came from almost 20 countries to discuss the vaccine clinical trial. And I had also opportunity to visit today BioVac and Afrigen. You know, we are talking about capacity building in human genomics. This is so important, and you can see from what I did this morning, we are really giving great importance on this area. It's important for us as Africa, learning from COVID, to build capacity and to have experts. We are talking, we can link everything to the primary health care, to the health system strengthening approach, but mostly by implementing one of the pillars of the new public health order. I will come back to the health system strengthening approach to show that when we are talking about the human resources, it's not just community health workers, it's also our experts that we have. It's really from A to Z. This human resource, we start with community health workers that are the key pillars of the health system at community level, but we go to the experts that we have for like human genomics in African countries. I was discussing with Professor Sall, who's leading Institut Pasteur de Dakar, about this issue, and I will attend the meeting in Dakar end of May. And our approach as Africa CDC is really to have a clear mapping in terms of the needs, and to start to approach that using all tools that we have, using all opportunities that we have, first internally before going to our external partners. I think the approach that we are promoting in Africa CDC is let us first think about what Africa can offer. We don't want to go without having this internal dialogue. And second, it's about exchange program. In Africa, we have countries that can provide support to other countries. Let us make it possible. Third, it's about identifying some niches where we can really say we build capacities here, but it's not just for one country, but it's for the region. You know, by being holistic, I think we can address the issue. And then we have this wonderful support from our collaboration with our colleagues from Western countries. We have innovation, we have universities that can support African institutions to build capacities. I think we have to take it from all angles by starting in Africa, knowing who can do what, where, and what we can do to facilitate the process. I think this is how we are approaching that in Africa CDC today.
Thank you very much. I'm now going to move to our next segment of our conversation, where we want to make sure that we have really learned the lessons, everything that we can from the COVID-19 pandemic. And I'm delighted to introduce our next speaker, and that's Dr. Finua Atuhebwe from the World Health Organization. As I said earlier, the WHO has just announced that we are ending the public health emergency phase of COVID. So it's an opportunity to look back and say, okay, what did we learn, and how do we make sure that the world is better prepared for whatever's coming next? So, Dr. Atuhebwe, what can you tell us about what should be the lessons that we take for making sure that we are better prepared for another threat that we know is coming? We can tell from climate change there will be another pandemic and more health threats coming. Dr. Atuhebwe.
Thank you very much for the opportunity to tell our story and to share the lessons that we've learned. I think a lot has already been said by the previous speakers, and I bring you warm greetings from Dar es Salaam, Tanzania, where we are actually running a workshop funded by the European Union with African countries sharing their experiences in lessons learned from the pandemic, and especially from the vaccine introduction. So just to set as part of the background, in 2021, while we're at the peak of the Delta variant crisis on the continent, with almost no vaccines and literally no funding to even prepare for the rollout of the COVID-19 vaccine, the European Union Humanitarian Office, the EU ECHO, granted us $16 million euros, and later gave us an extra 600,000 euros for the Republic when the United Republic of Tanzania did join the rollout of this life-saving vaccine. So what this 2-year grant was done was to support us to roll out COVID-19 vaccine, but also the reinforcement of national health systems resilience to epidemics, which is what we are discussing now. What most people don't realize is that Africa is very diverse, but we have a few, and different countries will tell their different experiences and lessons that were learned, but we have a few issues that stand out generally for the continent, and most has actually been talked about. But one main thing is that for a successful outcome for the next pandemic, we must have that high-level political will and leadership. Countries where political leaders were in control and took action did much better at managing the impact of the pandemic, the economic and the health on their health systems, and where the leadership did not show clear determination to manage this pandemic or showed a negative attitude towards the management of the pandemic, we also saw what happened to it. And we had few countries in Africa where we have seen what happened to them just because the leadership was not that clear or very committed to fighting the pandemic. Then learning from the essential commodity supply challenges that we had at the beginning, the erratic and limited supply of testing kits and other diagnostics, masks, the PPE, name it, at the start of the pandemic, and then the worst crisis being the COVID-19 vaccines on the continent, there is definitely need to strengthen and continue to support the local capacity. I think everyone has talked about this in research, development, and manufacturing of health commodities and vaccines on the African continent. That we do really appreciate what happened towards the end of 2021. We've got lots of donations. The Western countries really did a lot to support us with the vaccines, but had we had locally manufactured vaccines, this self-sufficiency would have been great to reduce the shortages and limit the challenges that we had to meet that demand during any epidemic. And we must prepare as we go ahead to ensure that we have that manufacturing capacity. So it's great to see the commitments that have been put forward by several donors, by scientists, to see that we have that local manufacturing capacity. And also across the region, we have also learned we need to build capacity in data capturing, analysis, and the use of interpretation and use of this data within the country, and to improve our surveillance and pandemic monitoring systems, which include vaccination in emergencies and pandemics. The live updates that we had, different dashboards, either at country level or at global level, these live updates on the cases and deaths during the pandemic were very helpful, not just for the scientists, but also for the general population, because people saw at what point they needed now to be really serious with taking up the measures that were the public health measures that were being recommended. Then again, without adequate, reliable, and timely data and evidence-based decision-making, we cannot have real-time prioritization of response strategies. So investment in electronic data systems, again, at that time, there was no time to rely on paper-based systems. So live updates and electronic database systems. But we've learned, especially on the African continent, is that we need to rethink our national vaccination programs, transiting from child-focused programs to whole population-focused vaccination programs along the life course, building systems and capacities in preparation for the next pandemic, because this is a continent that had not had experience. Most countries do not do adult vaccination, leave alone vaccinating the elderly who are already out of our systems or healthy adults that are out there. And this requires very good multi-sectoral approach and coordination, because the stewards of adult populations that required to be vaccinated and reached, like the private sector, like the NCD, the clinics that look after people with comorbidities, social welfare departments, were never part of the vaccination program. But now we have learned that during a pandemic, all these sectors must be brought together. And then we've also seen that there were no deliberate interventions at the start of the pandemic to take care of humanitarian settings, which is understandable. We're all rushing to see what we can do, but we forgot the humanitarian settings. So 3 months ago in Nairobi, UN agencies and humanitarian partners came together to honestly discuss and conduct a reality check on what we did wrong and what fundamental changes we can make to have future mechanisms for preparedness and reaching vulnerable groups in humanitarian settings, the IDP camps, the refugees, asylum seekers, and all that, and also people in hard-to-reach areas. And finally, I'll talk about the global solidarity. We saw all what happened at the beginning of the pandemic, especially when the vaccination started, where all the vaccines had already been booked and had already been paid for by the richer countries. And what happened when Africa we really relied heavily on COVAX and the Indian manufactured AstraZeneca, and when the Delta variant came and hit India and the export of the vaccine was closed from the country, we saw what happened to these continents. So the global solidarity in technology transfer, urgent funding support to the global south as we still struggle with our vaccine manufacturing and all that, sharing vaccines real time, like we saw towards the end of 21, would be highly recommended. This is something, and again, we've seen lots of discussions that have taken place, and we do really appreciate. Again, thank you very much for the opportunity. Lots of lessons have been learned, and I believe we could talk till morning. Thank you very much. Over to you.
Thank you very much, Dr. Atuhegbe. And as you mentioned, the global effort to vaccinate people against COVID was the world's largest logistical operation. It's never been done before. And again, you highlighted the fact that vaccinations tends to be seen for most people as something that happens in childhood, and it's not something that's dealt with the adult or even elder population. So huge challenges for everyone to take on, and also lessons to learn. And again, that reminder of the vulnerability of our global supply chains that were very clear as a result of the COVID-19. We've spoken quite a lot, and there's been some great comments in the chat. Thank you for sharing that, about the importance of domestic manufacturing, that Africa should have local supply chains. And our next speaker is going to share some of their perspectives, and that's Dr. Mulan, who is the Managing Director of CPT Pharma South Africa. That's a project partner of the Joint Action SIPS, which is the support towards industrialization and the productive sectors, which is implemented by SADC and GIZ. Dr. Mulan, you have experience of how to build up capacity. What's your experience of scaling up? What are the barriers and the opportunities, and what needs to be put in place so that we can have a thriving ecosystem for medical products in Africa?
Thank you very much, and thank you very much for the opportunity to share our experience and vision on local manufacturing and the efforts that we've been going through to build this critical capacity on the African continent. The 6th AU-EU Summit commitments focused on the availability of resources to start establishing the development of manufacturing capacity and infrastructure in Africa specifically. But numerous studies have also shown that your active pharmaceutical ingredient, which is part of your medicine and which we can describe as an engine in the medicine, is really the most costly part of that final product. And for the Africa manufacturers, pharmaceutical manufacturers, to be competitive and sustainable, you also need the capacity to manufacture these active ingredients locally. At this stage, most of those active ingredients are imported mostly from Asia. Our manufacturing, or our journey in the manufacturing of human APIs began in 2014, when we've identified a number of TB drugs motivated by the high incidence of TB as a co-infection to HIV/AIDS in the SADC region. And at that stage, as a company, we've been manufacturing active pharmaceutical ingredients for the animal health industry for more than 13 years. So it was an easy decision for us to translate our business model that we were using in animal health into the human pharma. Our model is based on competitive manufacturing technology, and it's really important to emphasize competitive manufacturing technology, but also skilled people that can develop, implement, and execute this technology. So we translated that, and we started with a project, but we quickly came across some hurdles in the human pharmaceutical side that we didn't experience on the animal side, such as prohibitive policies, access to affordable financing, and the lack of pharma quality skill sets. And all of these really delayed the implementation of our project. In this program, we were fortunate to establish a partnership with the SIPS program managed by SADC, as you've just mentioned. And we were able to secure funding from them that allowed us to work on 2 APIs, active pharmaceutical ingredients, one focused on HIV and one on COVID. We were also, so the funding that we received allowed us to develop and commercialize this technology for the local manufacturing of these 2 APIs. We also received some support from the South African government who co-invested in our facilities, and we were given a license for the manufacturing of the COVID drug molnupiravir by the MPP. At CPT Pharma, our vision is to establish an API manufacturing industry on the African continent. We've taken the first few steps with the first commercial plant will be commissioned later this year. The following step for us is to build a multi-API plant that can manufacture APIs for the treatment of HIV, TB, and malaria. Investing in greener and more efficient processes that we need to optimize to meet the manufacturing conditions in Africa. What applies in the Northern Hemisphere is not necessarily true for Africa. So we need to optimize and adapt our strategy and synthesis technologies. We also realize that we have a critical role to play in skills development and sharing career opportunities for African scientists and engineers. In the support of this, we are employing young researchers for our process development projects, and we are the commercial partner in the skills development initiatives driven by a number of the South African and SADC universities. To be successful in this, in local manufacturing, we do not need price premiums, but we need support through procurement policy reforms, giving preference to local manufacturers. We do need harmonized medical regulations across the continent, access to affordable financing for development and commercialization, and critical investments in energy and water to support the local industry. During the COVID pandemic, we witnessed a shift in attitudes from our African leaders and partners such as the EU about local production in Africa. The opportunity to speak at this platform organized by the AEF is a testament to the commitment of the European and African leaders to galvanize and mobilize resources towards local production. I'm excited about the progress that we've made, but I believe that we really need to continue to build on what we have established to realize this dream of having an API industry on the African continent. Thank you very much.
Thank you very much for your very detailed explanation of some of the challenges, and clearly this is a project that you've been working on for almost a decade, going back to 2014. Dr. Kasaya, you have your hand up. Would you like to intervene?
Yes, I think in the introduction of this meeting, you said we need to have a frank and honest discussion. Local manufacturing is one of my key focus area as Director General Africa CDC. And I want to recognize the wonderful job that my colleague Akona, who's leading the Partnership for African Vaccine Manufacturing, is doing. Look, we are talking about two components in one. First, we are talking about local manufacturing. Second, we are talking about the market. Local manufacturing, yes, we have the human resources, we have to build capacity, we have the technology transfer, and we are saying that we need end-to-end. We have the financing, research and development, and the national regulatory authorities. All of that must be in place. But it's not the end of the story. What is the market? We are targeting 1.3 billion Africans. Today, learning from COVID, many countries, they want to manufacture vaccines. This is not sustainable. It means, as Africa CDC, we are launching internal African discussion to say, what is the mapping that we can do? What is the value chain that we can bring? Who can do what? Because all countries can't manufacture the same vaccine. Otherwise, we are killing this very important initiative. This is at African level, internally. But we have also to talk with our partners, dialogue with Gavi, dialogue with UNICEF, dialogue with World Bank, all of them, to say, look, we know that in the beginning of this initiative, our companies, our manufacturers, they can't be competitive. Maybe the price will be a little bit higher than others. How can we support these manufacturers to continue to produce while we are building the market? I have to discuss with my colleague Wankele, who's leading the FCFTA. It means the trade environment, building the conducive environment in Africa, to see how together. And 2 days ago, I was meeting Dr. Tedros in Geneva to discuss that. I met Seth Beckley, the CEO of Gavi, to discuss that. I think we are taking this agenda seriously. And we really want to push this agenda. In July, I'm meeting head of state, African head of state, to see how we can come up together with a strategy to make sure that we are not killing this wonderful agenda of local manufacturing of vaccines, therapeutics, and diagnostics. We are not just talking about vaccines. I think when we are discussing, we must have in mind the two aspects, especially the market one. Over to you.
Thank you very much. And you're absolutely right. I invited us to have a frank conversation, and you've perfectly illustrated this point that it's obvious that people wanted to have their own manufacturing on their own soil as a way of protecting their population against exactly what happened a few years ago where they didn't have access. But as you say, then there's a smarter way to do that, to look at how do you actually create a marketplace to allow companies to flourish. So thank you for sharing that. Anders, I know you wanted to come in and comment.
No, thank you. Two quick comments. One, I'm sort of old enough to remember at the very early days from Gavi, at the Gavi board, the CEO of the Vaccine Institute in the Serum Institute in India was at the board. At that time, that company was extremely small, and they were looking then for a way to expand. Now they're one of the largest manufacturing companies in the world. So definitely, I mean, things can happen over time. But today we have a different situation, as also is just been said now. The leadership in the African region, the capacity in the African region, building institutions in the African region, and the resources in the African region now put us in a different situation. So rather than having a global model that we had very much at that time to try to encourage more capacity in India, in China, and in some other countries, today we have a different, I think we need to take this with a different way, a different approach. From the European side, we are very keen to engage and to see how we can be a partner to this and to make investments. There's going to be a meeting in Addis in between the European Union and African CDC end of June to discuss exactly this, how also European investments can be supportive of basically making this journey and this development also happening in Africa. Thank you.
Thank you very much. I'd now like to bring in Dr. Elsa Zekeng. You're an award-winning scientist and entrepreneur, and you have an absolute passion for opening up science for women and for a more diverse engagement. One of Africa's greatest strengths is its young population. That's an enormous talent pool for future researchers, the future scientists, the future clinicians, etc. So what can you share with us on how we make sure there is opportunity for young people to train and enter that and to allow that ecosystem to thrive?
Thank you very much, Tamsin. And it is an honor, obviously, to be able to participate and contribute to this conversation. And I hope to bring together some points that have already been raised and share really a perspective from a community level and young people. So as an entrepreneur and founder of Soka Data, a startup which is truly aimed at increasing diversity in clinical trials, over the past 2 weeks, we conducted some community research to understand two things. One, the level of engagement of communities and young people and their trust in healthcare systems and science. And two, to be able to understand how the handling of the COVID-19 pandemic has impacted these communities. And a total of 3 focus groups, a small sample size of UK residents, about 30 to 40 people, and participants almost evenly distributed in age between 18 to 60 and across ethnicities. But what this research highlighted were a couple of things. One, there was a 26% decrease in trust in government. 2, there was a feeling that scientists were acting upon what they were told by the government, or they acted for profit, and therefore increasing mistrust in science and scientists. 3, words that were used to describe communication and engagement from institutions such as the government, pharma, media during the COVID-19 pandemic included fragmented and disconnected, misinformation and disinformation, and overall feelings of anxiety, confusion, which led to more mistrust. The sample size had 56% women and 44% men, and over 50% of the women stated that the most frustrating aspect was their inaccessibility to their primary care givers, so GPs, and routine checks. Now, I obviously understand and acknowledge the limitations of this small research, and this is something that is ongoing, but it's a preliminary insight. But it still lets me ponder how much we're implementing from the lessons learned from other epidemics, such as the Ebola outbreak. And as someone who deployed to Guinea in 2015 during the Ebola outbreak with the WHO, and later on spoke on panels at the European Development Days in 2016 on universal healthcare, I shared that some of the specific challenges that some of the, especially the young women faced, was the inaccessibility to their primary caregivers. And now we're still seeing similar trends, the impact on sexual and reproductive health, the impact on gender-based violence, right? And so I think that it is absolutely key where we're creating and we're talking about opportunities, we're talking about rebuilding this new phase, right? I think it's absolutely key that we include these voices in the time and in the context and the time of the era that we live in. And by that I mean leveraging pull factors such as digital. We've talked about digital and the opportunities it provides to increase engagement and innovation. Leveraging entrepreneurship and the zest young people really have to be at the helm of change. Engaging with young people who are not satisfied with the status quo and are certainly not afraid to tell us so. But then we need to also acknowledge push factors that in the context of all of this, there is inflation, there's youth unemployment. For women, there's frustration and exclusion in managerial positions. So there's life happening. And I think some of the speakers have obviously mentioned before that it doesn't stop particularly at just the healthcare systems. And to this end is really very much highlighting that entrepreneurs and young people play such a key role in developing the forward-looking strategies, right? Firstly, as has already been stated, we know that data is the beginning of knowledge and insight. We understand that whether that's data on vaccine rollout, vaccine distribution, or community perceptions on how to develop strategies moving forward, it is absolutely imperative, because when we're talking about the market, we're talking about the masses, we're talking about the communities, it is these young people. We know the stats of what these young people, be it in Africa or across the globe, what the percentage of the population that they hold. So it's imperative to make sure that they're given a voice and they are part of the conversation in developing these strategies to represent the diversity of the population that we live in. Secondly, we've talked about investment, but very much sustainably investing in innovators and innovations on ground that support healthcare systems. And that is innovators and innovations that may be small and that may not necessarily have the gravitas or the bandwidth that other existing organizations happen, but is finding those innovations and supporting them, whether that is from a clinical research perspective in the lab right up onto the point of care delivery. Because there are ways in which these communities and these young people and these women will be able to access their fellow peers and colleagues in other ways that institutions will not. And lastly, ensuring that there's interoperability between the innovations and the solutions developed to existing systems, right? And it's whether that's on a technical level, on a managerial level, on an implementation level, this is absolutely key. Bring it back to certain points that President Johnson mentioned in his statement, Dr. Kaseya mentioned, and that is very much that leadership and that political leadership. I think just focusing on the level of mistrust that currently exists between these communities and the political systems, it is key that we bring these communities along the journey and not only try to react in a proactive way rather than a reactive manner, because these are truly the creators of today and the bearers of tomorrow. Thank you.
Thank you very much, Dr. Zekeng. I'd like to now invite Professor Agnes Binigwahu to come in. You've been our co-chair of the Health Strategy Group for the AEF for the last few years, so you've had an insider view of this perspective, but you've also been a very long time advocate and campaigner around global health equity, and we've touched on these issues of inequalities throughout our conversations. Professor Binigwahu, the floor is yours.
Thank you for having me, and also I'm very pleased to participate in this very interesting conversation. I'm not going to talk a lot, but I just want to remind each and everyone that clear studies on trust in the health sector have been conducted by Wellcome Trust and Gallup Institute just before the pandemic. And the study that was done after was that in countries where there was trust in the health sector, there was trust in the government and the judiciary system. And those countries have performed better in the reaction in collectively with their community in reacting against COVID. So it's very important. And it's very important that one day we take time to go back to what we learned from those studies, because this is what we have to really bring out in between two health threats like COVID. Also, we know that those countries have better response to the scientific requirement when sent by the ministries of health. And they don't discuss, even when they didn't understand, because of the trust, they say, okay, we are going to do, but take time to explain. But when mask was there before even understanding why, the people have put the mask and just wait for the explanation because of the trust. So this social determinant of health that is quite neglected we should focus on that. And also what I want to say is that there are places in Africa where there is a good interoperability in between the system, between the collection of data, recording the data, placement of data, and consulting the data and take strategies and plan accordingly. So this can be documented. They are very simple, not costly, and can be very useful. And it look like all countries doesn't look alike, but it's example from Africa that can be easily replicated in Africa. Thank you.
Excellent. Thank you very much. And again, you're echoing the message from Dr. Kasaya, which is that there is good practice that can be shared within the continent. There are lessons that can be learned that if we've got that open dialogue. And thank you again for highlighting the link between trust in institutions and then trust in health advice and scientific advice and better outcomes. Tony Silas Dauda, you've got your hand up. You'd like to intervene. Please go ahead.
Thank you so much for the opportunity. I just wanted to add to some of the submissions made by Dr. Jean as well as Elsa. So, of course, pandemic preparedness is beyond health and also beyond the health infrastructure. I think that one thing that we saw during the pandemic was the fact that some African countries did experience challenges with getting the vaccines to the vulnerable population that needed it. There were issues around supply chains, instruments needed for supply chains, road infrastructure. And I think that when we are discussing pandemic preparedness, we need to factor in all of these other aspects, because in the end, there wouldn't be a point of preparing so many vaccines if the people that are meant to receive these vaccines are unable to access it. I also wanted to add that when we also discuss pandemic preparedness, we should also look into other sectors as well as education. We saw how education was disrupted. Millions, of young people were out of school because the sector in itself was not prepared to accommodate such an unprecedented situation. We saw jobs, and I think that we need to include the fact that we need to make changes in how society in itself runs. Beyond policy as well, I think that we need to consider other policies like social security policies. Most African countries did not have a means to support their families while they were losing jobs. So I think that while we have this conversation around health and the research that are needed for production of the medicines, we should also consider all of those other sectors that would support the implementation and delivery of the solutions that we are proposing in this conversation. Thank you so much.
Okay, thank you very much again for sharing your perspective, because it's always useful to hear from young advocates who've got something to say. We are running out of time, and I think this first in the series of dialogues looking for the AU-EU tracker is fantastic. It shows that we have things to say, we have things to share, there is progress that needs to be made, and I have to say that I was inspired and felt very optimistic hearing the very hard thinking that's happening at the ACDC and other organizations saying, how do we make this happen? How do we support it? Professor Binigwahu, can I invite you to just say a few words to close our meeting? And as I mentioned, this is the first in a series of conversations. The AEF, when it was set up, we said we wanted to create a space for new dialogue and narratives between Africa and Europe. And the one message that came through in our first launch was, no more words, please. Let's translate it into action. And we have now converted that into a tracker process. So you'll be able to find on our website information about this process where we're tracking big political commitments to see what's being delivered on. So this is part of our return to the message where people said, no more talking, let's see some action. We're here to say that we are measuring that. Professor Binigwahu, can I invite you just to say a few words, because we've run out of time and there's a lot more still to say, but so just to close us.
I'm going to be very brief. You hear me?
Yes, we do. Go ahead.
So I just want to extend my deepest gratitude to all of you here present for your invaluable participation in this crucial dialogue on establishment of an African-Europe partnership on pandemic preparedness. It's key because we all know that it's not the last one, and we all know that COVID could have been more damaging. So we have to be very scared for the next one and be ready. So today's discussion have underscored the valuable the value of working together and in synergy. So we all acknowledge this, and we are going with this group to foster that beyond this group and make it a reality for all the sectors that we need. It's beyond health. So as estimate an influential leader, it is our duty to advocate for, when possible, also to contribute personally to mobilize for improving the health care infrastructure as basis of equity in outbreaks and pandemic response. And for this to be possible, we need an equitable allocation of resources inside countries, but also in the region, as much as also the dispatching of well-trained, skilled health workforce. By fostering a spirit of collaboration and solidarity, we can fortify our health system at every echelon, be it within local communities, national institutions, or through intercontinental partnership, and have an harmonious approach that will improve the ability to rapidly detect emerging health threats and build an effective collective response. So I just want to thank you. This is the beginning. We have a long way to go. We were lucky with COVID. Next time, we don't have to rely on chance. We have to be more prepared, because in reality, we were not prepared. And we are there for that, and to help our leaders in the health sector in our countries, in our region, our continent, globally, to be prepared for the good of our population. Thank you all.
Thank you very much, Professor Binigwaho, and I echo your thanks to the speakers and to all of you who participated so actively. It was great to see at the beginning, we saw where people were joining us from, and it was truly from across Europe and from across Africa. This, as I said, is the first in a series where we will be bringing you, through our AU-EU tracker, progress that's being made towards the big target, and also identifying where we still need more political support and more information. So if you go onto our website, the africaeuropefoundation.org/tracker, you'll be able to see in each different sector a lovely data dashboard, and we've heard about how powerful data dashboards are. This will give you an idea very clearly what's been done, what still needs to be done, and where we need your support to create political momentum. Thank you very much. Goodbye from Brussels, and see you at the next event on the 5th of July, which will be looking at sustainable growth and job creation between 3 to 4:30 p.m. Thank you and goodbye.
Bye.